Hey there, this is Lindsay Marsh from the Texas Homeless Network, and we are going to go over the 2015 point-in-time survey instrument. It's going to look pretty much like previous survey instruments. There are a couple of changes, and we're going to go ahead and go through that. But for those of you who are new, this is what it looks like. We're going to start here. So the person conducting the survey, you need to go ahead and put your name there, what city you're in, and then either the facility where you're conducting the survey or a general street address where you're conducting the survey. If the individual does not want to take the survey or your volunteer deems the situation too dangerous, go ahead and click this box right here. And if possible, if we could get a gender from that person, that would be great, but it's not necessary. Moving on. So question number 1, we would like to know the date of birth or the age. If you give us both, that's fine, but we really only need one. So it's up to you or whatever the person would like to give you. Moving on to number 2, there are 4 options here for gender. It's pretty self-explanatory, just however that person self-identifies. Number 3 is race. There are 5 options here, and this is a check all that applies, so you can check more than one box. Number 4 is whether or not that person considers themselves to be Hispanic or Latino. It's a simple yes or no answer. Number 5, do you have a physical or mental disability? Again, this is check all that apply, so you can have more than one choice here, or you can have none of the above if you don't, or if that person does not have a physical or mental disability. Number 6, this is probably the most important question here. Where will you be sleeping tonight? So we need to know where this individual is going to be sleeping tonight. And so we have a lot of different options here, and it's really important that your volunteer reads through these before heading out into the field for the day or for the evening. That way they can help guide them, or they can ask more questions to get a more accurate answer out of them. So in the past, the thing that we saw the most is that people would create their own box and say, living with sister. Except the thing is that we have that option here. It's sharing housing of other persons. So make sure that your volunteer reads through all of these options so they're able to help the individual complete the survey. Let's move up to question 7. This one, we want to know what best describes this individual's family or their household staying with them today. Not the household, what it looked like last week or what it might look like in 2 weeks, but what the household looks like today. So there are several options here. Ones that we need to go over: a single unaccompanied minor. This is somebody who's under the age of 18 and living on their own. Or a household with only children. This is going to be people 17 or younger, probably brothers and sisters staying together without any adults. And those are the two options that sometimes give people difficulty, but usually these families are pretty easy to spot. So if there are children in the household, you want to go ahead and ask question number 8. Do the children who are under the age of 18 need any of the resources listed below? And again, this is a check all that apply. So you can have more than one answer here. So moving on, we're going to go to the box that contains some questions regarding military service and VA benefits. So in past years, we have just asked whether or not somebody had served in the military, and if they had answered yes, then we would ask if that meant that they had ever been in the National Guard or called up as a reservist. This year, however, HUD is trying to capture as much data as possible on veterans. So what we need you to do is we need you to go ahead and ask question number 9 and also question 9A. Even if they say no, you still need to ask question A. The reason behind this, HUD indicates that sometimes people who had served in the National Guard or had been called up as a reservist don't always consider themselves to be veterans of the United States military. So this is a way just to double check. It's a way to grab more information. So regardless of what the question is here on 9, regardless of what they answer, go ahead and ask question A. So obviously if both of these are no, then you need to just you need to move on. So it looks like there is typo here, so what we'll do, don't worry about that, this will be changed on our website. We're going to ask you just to move on to question 10, not 11. Want to know if the person is currently homeless? Yes, no. Again, if it's yes, we want to ask this box of questions, and if no, then you can skip all of these. If the person is homeless, we want to know what describes their current situation. Is this their first time homeless? Have they been homeless a couple of different times in the past 3 years, at least 4 different times, or have they continuously been homeless for 1 year or more? We also want to know how long their current episode of homelessness has lasted, and we want to know what city they were living in when they became homeless this time around. And then the last question there in the box is whether or not the individual has been homeless another time in the past 12 months. So moving on, this box right here, this is for any additional members of the household. So we've already captured the information for the head of household, obviously, here on the first page. So what we want to do now is get some information for the additional members of the family. So go ahead and tell us what the relationship is to the head of household. Is this their spouse? Is it their child? Is it their mother, their brother, their sister? Go ahead and fill that out. And just to make sure, when we enter this data in, give us the first letter of the first name and their age. Really the first letter of the first name is just to make sure that we're not duplicating any people. And then pretty simple questions, just like we asked on the first page, gender, the race, whether or not they identify as Latino. If they're an adult, go ahead and answer the question on their veteran status, and then let us know if they suffer from any physical or mental disabilities. And then when you're done, if you could, please total up the number of adults as well as the number of children. And so when you put the number of adults in here, this includes the person taking the survey. So, count up these guys over here, and then just add 1 for the person who's taking the survey, and that'll give us the total number of adults in the household, and then go ahead and give us the total number of children in the household as well. So moving on, the next box concerns healthcare. So we are going to be asking questions about medical care, dental care, mental health care, as well as substance abuse care, and then HIV/AIDS treatment. We want to know for all of these, we want to know whether or not the individual needed this care. And if they say that they did need this care, we want to know if they received the care. And oftentimes you'll see probably with the majority of your folks who say that they needed dental care, a lot of them are going to say no, that they did not receive dental care. That's a pretty big gap with this particular population. But however, if they did receive care, if they say that they received any particular kind of care, we want to know where they received it. And your options here are emergency room, a private doctor, the VA, a community clinic, MHMR, a social service agency, or other. Moving on to question 17, we'd like to know the reasons this individual became homeless, and again, this is a check all that apply, so there are different options here as well as other. Question number 18, we'd like to know the highest level of education. So, if they got their high school diploma and they went to some college, then the highest level there is some college. So it goes all the way up to a master's degree or higher. Question number 19 asks whether or not they're able to work. If they are able to work, we'd like to know what their job status is. If they're not able to work, we don't need to know what their job status is because they're not able to work, and that's fine. So we just go down to question number 22. However, like I said, if they are able to work, we want to know their job status. There are 6 different options here for someone's job status, and if they say that they're unemployed, we'd like to know how long they've been unemployed. And moving on to question 22, which of the following services do you need? Again, this is a check all that apply, so they can check more than one box. And so we have different options here. These are always the top getters for the past, I'd say, 5 years with the point in time count. So we just put them all on here to try and condense that a little bit. So that concludes our overview of the 2015 point-in-time survey. It's pretty easy. Again, I highly recommend that all of your volunteers read over the questions as well as the answers before they go out and start interviewing people. It'll make it a lot easier. They'll be able to answer questions, or they will probably be able to anticipate certain questions that folks might have. So, if you have any questions, please just let us know. Thanks so much.